Welcome back. It's a topic many men avoid, but starting the conversation could save a life. Roma sat down with University Health and learned all about the signs and symptoms of prostate cancer and the importance of early detection.
Dr. Milind Shah, he is a urologist at University Health. Thank you so much for being with us today. You know, this topic is very important for the men in our audience. So wives at home, girlfriends, moms, anybody, you got to take care of the gentleman in your life because we're talking about prostate cancer and the risk factors, right, doctor?
That's right.
And what are those?
So age is a significant risk factor for prostate cancer. Prostate cancer is rare in men under the age of 40, but the risk does increase as men get older. Race is also another important risk factor. So men of Black ancestry not only have a higher risk of being diagnosed with prostate cancer, they're also more likely to die from the disease. Also, family history. Having a first-degree relative, such as a father or a brother with prostate cancer, increases the man's risk.
A lot of our audience may be wondering right now, well, what are the symptoms as a man? What should someone be looking for?
What's tricky about prostate cancer is that it's in its early stages, there often are no symptoms, which really underscores the importance of screening in the first place. As the cancer grows or spreads, it may lead to frequency in urination, sometimes waking up at night to pee. It may lead to a weak flow. It may lead to blood in the urine or the semen. As the cancer progresses or even spreads, it may result in bone pain, unexplained weight loss, or fatigue. It's important to note, however, that just because a man does have a change in flow, or they have blood in their urine or their semen, it doesn't necessarily mean that they have prostate cancer. It could be due to other benign, non-cancerous conditions such as just an enlarged prostate or prostatitis. Prostate cancer is the second most common cancer diagnosed in men after skin cancer. It's also the second leading cause of cancer-related death in the United States after lung cancer. We typically begin with a blood test called a PSA, or a prostate-specific antigen. If a man has an elevated PSA level, the next thing that we do is we actually repeat the value prior to proceeding with anything else. If the repeat value is confirmed, then we may proceed with imaging or directly to a prostate biopsy to confirm the findings. In addition, there are times we may use a DRE, or a digital rectal exam, alongside a PSA to help assess a man's clinically significant risk of developing prostate cancer. For average men at risk, we typically start screening between the ages of at the age of 50. However, we can offer a baseline PSA test for men between the ages of 45 and 50. For men at higher risk, and those include men of Black ancestry, a strong family history, or certain inherited genetic mutations, screening is typically recommended between the ages of 40 and 45. Now, for men above the age of 70, it's really important to have a conversation with your healthcare provider as to whether prostate cancer screening is right for you. And of course, we have great treatment for prostate cancer, including surgery, radiation, but of course, they can have side effects, and sometimes significant ones, such as erectile dysfunction or incontinence, which is a leaking of urine. It's also important to note that there's been a surge in our country with an increase in testosterone replacement therapy, or TRT. And it's important for men to obtain a PSA prior to initiating testosterone replacement therapy, prior to commencing therapy on that, and to exclude a prostate cancer diagnosis, and then continue with regular screening after the fact. So as you can see, there is a lot of variability on ages and what's right for a man in terms of screening, and that's why it underscores the importance of seeing your doctor, see what's appropriate for your situation, as every man is different.
Definitely. Amen to all of that, doctor. If people want to get more information or maybe they want to go get a screening, can they call University Health?
Absolutely. Our website, we have our main number as well. They can reach out for an appointment.
All right. Well, thank you so much for all of this very helpful information.
Thank you for having me.
Coming up, a fashion show has made its way to our studio. Find out how you can take part in this event that's helping benefit Seguin's first responders after the break.